Hey to all those seeking vibrant health. It's Dr. Rachel Northern, and it's my weekly health tips. And today, my special guest is Betty Jarvie from Chapel Hill Body Works, and she is a licensed massage therapist. And I've been in practice 17 years, and I've been working with massage therapists from the beginning of my practice. It is just a good working relationship. I focus on the hard tissue, I focus on the bone and the nervous system, and they also work a little bit with the nervous system too in a different manner, more through the soft tissue and muscles. So it's like a very good working relationship. Sometimes I have patients come in and they have scar tissue or adhesions, things that are just not letting that correction. When I do the correction, it doesn't help the body hold that correction because they've had patterns that they've developed. And when I refer them to massage therapists, I just totally see them improving and faster. I myself go to massage therapists, try to at least once a month to maintain just a healthy regimen, maintain my just muscles to keep them healthy, and it is, pretty essential for me to make sure it maintains my body. And I know if I miss a month, if something comes up, I just know I just don't feel as good. And same with my adjustments. If I don't get my adjustments regularly, from my chiropractor, I don't feel as good either. So I'm always focused on how I can not just feel better, but function better. And I don't want to wait till I'm sick or I don't feel good or I'm sore, or I threw my back out to treat myself. So I do refer out to massage therapists. I do not have one in my practice because I do want to let the people who specialize in that just focus on that, and that is their baby per se and their practices. So I'm going to turn it over to Betty Jarvie, and she can tell us about what she does and the benefits. So let me turn the camera around once I find it. Where is it? Oh, there it is. Hi. Yep. Hi, Betty.
Hi, Dr. Rachel. Thank you so much. Thank you for having me as your guest. I really, really appreciate it. So you had asked me to talk a little bit about just the relationship with massage therapy. I like to talk about, we've talked about this in the past, where massage therapy and chiropractic is such a beautiful marriage.
Mm-hmm.
We specialize with the soft tissue and you specialize with the framing, and so you can't have, I think it's more beneficial if you address both of those.
Mm-hmm.
So if somebody has an injury and you get a chiropractic adjustment and you get the soft tissue release, you recover a lot faster.
Yes.
And so for those of us that don't like to be out of commission for long, it's a really nice marriage. So we do work with my practice, which is right down the street from here. We do work specifically with chiropractors. We also are referred by physical therapists, other medical doctors, different practitioners where if they feel like they're plateaued. So what's really beautiful about all the different integrative alternative things that we do is I like to work with practitioners such as yourself, where if you say, I've plateaued with my patient, I feel like they need more than I can give them instead of continually, repeatedly just not getting anywhere. So that's where I like working with other practitioners as a body worker. So we work with the different practitioners that refer to us, and we communicate well with them. And then what we have in our practice is we have a group of us. There's several of us, and we all have our passions. And so as a small private business owner, I do this because I'm very passionate about it. I worked for corporations, and so I designed my own business exactly to be able to do my passion and to be able, like you said, to do what I'm good at and not necessarily be directed by a corporate entity and tell me how to do my job. So, but what I have is I also have other practitioners that have the same thing. So I attract similar people like me, but their passion might be a different modality as to what that they like to do. So I love the specific body work. I love the therapeutic massage. I like to make a change now. I like to figure it out. So after doing specific traditional body work for years, I wanted to learn more. So many years ago, I started my cranial sacral training, which is very profound for me. And then that led me into visceral manipulation. And so I have some therapists that do cranial, and I have someone that specializes in neuromuscular. We have gua sha, we have cupping. We have a lot of different lot of different modalities within the building. So for instance, if you're not responding to what I do, we have several other practitioners that you might respond to. So it's just a really cool way that we do our practice. Some of the things that, so you refer us to people that might have an injury, a frozen shoulder, or you're not getting good resolution, or you've got them 75%, and they can't seem to get that last 25%, and you intuitively know that it's some scar tissue or a fascial adhesion. And so that's what we specialize in. We spend a lot of time specifically with the fascial adhesions. So it is time consuming. It does sometimes require more than one session, but we get a lot done. Some of the people that come to us, I'm trying to think, so you send people to us that have muscular issues. We have some people that are sent to us for abdominal issues. So say for instance somebody that, and then we sometimes refer them to you, so they come to us because their doctor sent them to us for abdominal work because they can't go to the bathroom. So we can manually help that happen. So it's not just for a low back pain, or it can be. So there's a lot of different reasons. People that are stressed do really well with massage therapy. Massage therapy activates the nervous system, the parasympathetic nervous system. And so if you're in this fight or flight, like kind of some people are right now, so if we can get them on the table and get them to relax and to turn them off, then it decreases anxiety levels and such. So your heart rate naturally goes down, so it can decrease blood pressure. So people with arthritic pain do really well. So people with rheumatoid arthritis or osteoarthritis, they relieve pain. They get pain relief there. Post-surgical. So we do a lot of post-surgical. So what we do is we go in there, and after they've been released from their medical doctor, their surgeon, so we start gently massaging. And what we do is we're creating the striations in the scar tissue to heal a little bit better versus making this big mass where now they have an issue 6 months down the road with their limited movements because of scar tissue. So the sooner we can get someone post-surgery, the better that they can heal, where they don't even have any post-surgical issues. I can go on and on. I don't know if there's something specific.
Yeah, so a lot of times I have people that may be fearful of going to a massage therapist. Just like, how does the procedure go when they come into your building? How do you handle people that are just kind of fearful or insecure of their body, getting on a table? How do you handle that?
So we do have this really awesome process. I have a 5-step process, but when we get them into our building, we have a health history that we fill out with them, and we communicate with them. So we sit and talk with them before we even start the massage, and we usually do it in the room so they can get a sense of where they're at. And so what we do is we tell people we have the verbal agreement what they're there for. So if someone comes in and says, "Well, my doctor referred me because I have back pain," so then we just simply talk them through the process. We say, "Well, we'd like to work with you. We're going to respect you. So we put you on this table, and you're always covered. We never expose you, and there's never a reason for that. And we drape. We explain our draping, and we have them undressed to their comfort level. And then we explain that. We allow them to use the bathroom. I mean, there's no pressure. It's a very laid back. We do it very respectfully. We've never had anyone complain that they felt that they weren't honored, or they never felt like they were going to be exposed. So it's kind of a pet peeve of mine. And so there's a lot of communication before we do excellent draping, really honor that, and we're very, sometimes we can kind of tell, people will say, "Oh my God, I don't want to take my clothes off." We'll actually massage people with their clothes on. It's different, it's not as beneficial, but that's where we start them, and then eventually they're more comfortable, removing their shirt. But we never expose, like the genitals or anything. They're always face down. It's completely tightly covered and such.
Awesome. How about recommendations for people like myself or athletes, people who maybe don't have pains, but I'm sure with repetitive motions are probably accumulating maybe some adhesions and things like that? What would you recommend?
So what we do with people that come in just for maintenance or knowing that they have that is, we would recommend if, first of all, sometimes people come in and they don't feel like they're sore and then we touch them and, they're like, oh my God, I didn't even know that was hurting. And so we might find patterns that they're starting and they don't even see it because the body always, it just adapts. So we don't even know we're getting in trouble. And so that's kind of a thing for me. I like the structural, so I kind of geek out on the structural, and I can usually tell how people, their sleep patterns based on what their body is showing. And so I'll usually give them that information if they want it and say, if you want to change that, nip it in the bud. So we could give them stretches. Sometimes I just tell people, do you do this all the time on this side? And then they'll say, how did you know? And I'll say, well, your body is showing that pattern because the muscles will change shape to accommodate that structure. So I'll just say, mix it up or just honor it. And it's not real intense. It's not judgmental. It's helping. Those are things that I wish that I would have known years ago when I had chronic injury and chronic nerve pain. Nobody ever asked me how I functioned outside. And had I known, I sat on one of my legs for years and years and years, and it created a muscle imbalance. And no one ever asked me. And I had this chronic low back pain, and I think that if I would have known that. So those are things that we do. So stretching. So if you're an athlete, we might even specifically, if you're a really hardcore athlete, we might put you with a therapist that's really their gift, where maybe it's not my gift to coach you on your running skills. So, or refer you out if necessary.
Okay. Well, thank you for your time and expertise, Betty.
Thank you so much.
Take care, everyone.